Welcome to another episode of the Back to School Shootings podcast. My name is David Reedman. I'm the creator of the K-12 School Shooting Database. And this podcast is uncut conversations with experts in the school security industry. This week, I'm really excited to be joined by Sonali Rajan. She is a professor in the Department of Health Studies and Applied Educational Psychology at Columbia University Teachers College. She's also the co-lead of Columbia University's Scientific Union for Reduction of Gun Violence. And I asked her to join the show today because in my Google alerts, there's a new paper, a new study using the K-12 school shooting database for some really interesting applications. So Sonali, thank you so much for joining the show.
Of course, so happy to be here.
So before we get into your research project now, I would just like to give the listeners an idea of what's your background? What do you do? This Department of Health Studies and Applied Educational Psychology is really broad. What took you there, and how from there have you gotten involved in gun violence prevention?
That's a really great question. And I think if someone had asked or said to me 10 years ago, 15 years ago, that my career really would be dedicated to the prevention and study of gun violence as a scientific issue, it was not on my radar in that way, not at all. And I don't know that any of us necessarily go into this with this as the specific topic or area, and maybe we all fall into it in different ways. But so my undergraduate degree is in biomedical engineering from Cornell University, and I loved my time as an undergrad and all of that, but I took my senior year of college. I actually had to fulfill a random general elective requirement. And so I looked at what fit into my schedule, and it happened to be a education course, an education class. And so it was a really interesting course, the way it was structured. The fall semester of that year, it was all about, you were in the classroom learning about, Dewey and educational theory and what pedagogy means. And, it was very interesting. And then in the spring, what the faculty did for this course is they actually placed every student at a local school in and around the Ithaca area. So Cornell's upstate in Ithaca. And so for my spring semester of my senior year of college, I had just spent nearly 4 years dedicating my life in a lab studying biomaterials and growing cells in petri dishes and really thinking that was going to be my career. And I spent 3 mornings a week that spring semester driving about an hour each way to a very, very tiny little public middle school outside of the Ithaca area. And I loved those early mornings. It was the early wake up and getting a chance to go and spend time with these middle school kids in a school, working with their teacher, learning about the classroom, just spending time essentially as a support for a public school that, like many public schools in this country, are historically very under-resourced, was truly one of the great joys of my undergraduate experience. And that experience gave me a lot of pause and question and said, maybe engineering isn't actually what I want to be studying and doing. And in a bit of a whim, I decided to pursue initially what was a master's degree in a field that essentially I would call it school health. So looking at the connections between health and learning, because I was still very interested in biology and the human body and health and all of that sort of kind of area of work, but very much enjoyed working with kids and was very interested in what was happening in a classroom. And so this idea of thinking about the connections between how children physically and emotionally are doing and then what happens during the school day was just something that I found really fascinating. And I did my graduate work here at Columbia as well, and ended up staying and doing my doctorate work and all of that. And anyway, here I am many, many years later. But the gun violence connection really emerged, my doctoral work really focused, and my dissertation work, and even into my postdoctoral years, really focused quite a bit on children and adolescents, the health of children and adolescents in a lot of different ways, their mental health and their well-being, substance use, are they getting enough sleep, physical activity, access to different types of programming in school. So I was thinking about what we would call the whole child. And I really loved it. I still do. It's work I deeply care about. But in 2013, my former college roommate, who also is a former bioengineer, she and I, and she's actually now a faculty at NYU. She and I decided to, well, wouldn't it be fun to, she's one of my best friends, and she said, wouldn't it be fun if she and I wrote a paper together? And so we took about 10 years worth of data from the CDC. We were really interested in looking at data from the Youth Risk Behavior Surveillance System. And we took about 10 years worth of data, and we said, well, let's just try to make sense of, she's a bioinformatics scientist. And so she was like, wouldn't it be cool to look at some patterns in the data? And so I said, it would, but there's so much about, like, where do we start? And so we were talking and thinking through this, and we said, well, something we don't actually really fully understand is there's this one question in that survey. So many of our listeners might know this. But there's one question in the CDC YRBSS that asks about gun possession. It's just one single question. And a little bit on a whim, Kelly and I said, well, wouldn't it be interesting to understand what are some other behaviors that correlate very strongly with that variable? Like, we hear a lot about mental health, but we don't really know what else is going on. And so we took 10 years worth of data, and it was really one of the papers in my career that I've enjoyed writing and thinking about so very much. And also to work with a colleague and a friend who is just thoughtful and brilliant is also just a joy. But essentially, one of the big things that came out of our paper, so we ended up writing this paper. We published it in PLOS ONE in 2014. And in that paper, essentially what we found, and this is by no means groundbreaking, but what we found in our work was, yes, absolutely, mental health and all of these indicators around poor mental well-being certainly correlate very strongly with gun possession. But the thing that we saw that also was very interesting, and I had not, at least in my just cursory understanding of gun violence as an issue, what we found in our work was that the kids who also were having previous experiences with violence or having been exposed to violence of some form, or the kids who were essentially saying, we just fundamentally don't feel safe, those were the kids who were also far more likely to report carrying a firearm. And I know when we say this out loud, it's like, well, obviously, I mean, this, again, it's not groundbreaking. Intuitively, it makes so much sense. But for me, that was really a light bulb moment to realize here we are talking about physical activity and sleep and nutrition and test taking and trying to think about children and their well-being in these really very specific ways. But look how many kids fundamentally don't feel safe walking to and from school, in school, out of school. What are we doing about their safety, perceived or otherwise? And that really began for me a lot of exploration and data collection and grant writing and paper and sort of a whole research career into the area of gun violence and gun violence prevention. And what are we doing essentially to help children not just go to school in buildings that are free from violence, although that, of course, would be ideal, but schools should also be places where children can thrive. And this notion of recognizing that safety is so foundational to a child's health, to their well-being, and to their ability to learn, just has been and continues to be at the core of the work that I do. So that was a very long way of arriving at how I got here, but it wasn't a clear direction. It took me, I think, some time to figure out what the connections between my interests and work were. But I have since, this was now 10 years ago, which is crazy to think about, but I have since just really devoted the bulk of, and now really the entirety of my career to this issue, and have been very, very lucky over the past 10 years to get to know and work very closely with extraordinary scholars and collaborators in this space, David, of course, you being one of them, and learning from others and recognizing the real challenges on every aspect, from, the politicalization of this issue to the way the public discourse is shaped, to even getting a handle on what are the fundamental questions we should be asking and answering. And that actually is how Charlie Brandis and I, who co-lead this NICHD study right now, and we are supported by an extraordinary team, but that particular paper, that particular grant that we're right now in the middle of, very much emerged from wanting to ask some very practical questions that schools, rightfully so, would like to have answered. So I'm happy to go more into depth there, but that's the long way of how we arrived here today.
Yeah, before we get into that paper,
yes,
it's fascinating that your research from 10 years ago really follows the same track as the K-12 school shooting database. That was not a project that I intended to start or be involved in, but in the aftermath of Parkland, I wanted to understand school shootings and how to prevent them. There was just no data. We couldn't tell you how many incidents happened in 2017 or 2016. Was Parkland worse? Was it an outlier? Was it an anomaly? Was it part of a pattern of recurring violence? And in that data collection, it became so difficult to define what a school shooting is that I just started collecting data on every time that there's a shooting at a school. And when you look at that, this pattern that's changed in the last couple of years, the number of incidents at schools has increased about 10 times. And what has driven that increase is escalations of disputes where either students, parents, community members who are at the school get into a fight with somebody, they're carrying a gun, and that simple dispute turns into a shooting. And that comes back to this fundamental idea of safety. Why is somebody carrying a gun? They're carrying a gun because they feel that they may be victimized. But the byproduct of that fear is that minor disputes become life-altering situations for everybody involved. Whether it's a bystander being killed, somebody now facing attempted murder charges for what could have been an argument. It all comes back to this same piece of we have to understand the root causes for different behaviors, understanding all the different ways that gun violence is manifesting in schools. Because if you look back at Columbine, if we didn't have this data in 2018, what were any of the policies and practices and investments over those 20 years based on? Was there any program evaluation to determine whether these things are effective or even detrimental? Because the number of shootings is increasing, the lethality of the shootings is increasing, despite billions of dollars of investments. So I think your paper is something that is probably one of the first studies I've seen that's trying to figure out what are the policies that are being adopted by schools, what's the landscape of these practices, and then using empirical evidence and data, what's the effectiveness of these? Can you kind of talk more about where you're going from there?
Absolutely. And so this paper you're referring to is a protocol paper that our research team just published in PLOS One. So it's funny, PLOS One, a little bit of a full circle moment there. And this is work that, again, I was saying is funded by the NIH and is co-led by Charlie Brandis and I here at Columbia. So this sort of goes back to what we were just saying earlier, which is to say, gun violence is, first of all, it's just, as you know better than anyone, David, it is such a persistent, devastating, growing crisis. It has completely shaped the way in which our communities and schools live and learn and play. It is in every aspect, right, of our society. It impacts our economy and our healthcare system. And there's no aspect to, and I'm speaking specifically to gun violence in the U.S. That's my area of expertise. But, there's no, the issue is so challenging and so prevalent. And then, as we also tragically know, it is now gun violence now being the leading cause of death among children and teens in the U.S.
We have to foot stomp that. Say that one more time. Gun violence is the leading cause of death in children and teens.
In the United States. It surpassed motor vehicle deaths. Recently, there was a paper in the New England Journal of Medicine a couple years ago that documented this shift and this trend, and it is so devastating. And as you were highlighting earlier, it is also preventable. The challenge is we need to know what levers to pull, what solutions to implement, and what should be scaled. And maybe at the same time, what shouldn't be scaled. And I think these are important, difficult questions we need to ask and answer. We owe it to our kids, to our school communities, to our teachers, to school leadership, to the 51 million kids. I mean, our K through 12 public school system in the US serves an estimated 51 million children per year. So
51 million children who, when they are dropped off in the morning, they're in the custody of the state. It is the responsibility of a school, which is different from any other place in society, that a parent is giving your child to an institution with the expectation that your child will be safely returned to them at the end of the day. And that social expectation is not being met. And that's part of why we need to understand this problem, because there are random deaths, there are random illnesses, there are all of these uncontrollable things that happen. But within the context of a school, you have a very clear environment with a clear set of expectations. Yet there continue to be gun deaths.
There continue to be, exactly. And I think, and I will say this, and then again, schools, like generally speaking, are relatively safe. And I know when we talk about gun violence, there's lots of different kinds of gun violence, right? There's mass shootings and suicides, which suicide by firearm, of course, comprises the bulk of the gun violence we do see in this country. But nonetheless, there's a lot of other types of firearm-related harms. And to build on what you're saying here, we're absolutely interested in, of course, preventing gun deaths, preventing injury, but also thinking about all the other ways in which children and their school communities at large, and by extension their families, may be impacted by exposure to gun violence in different forms. So this is a little bit of another aspect of the work that I do and my colleagues and I do here, which is to think about gun violence as an adverse childhood experience, meaning, of course, we need to prevent any sort of fatality and injury that's like a physical, that would be directly physically caused from a bullet, of course. And we also want to understand and reduce the likelihood that children are witnessing gunfire, hearing gunshots, that they may have a peer who gets shot or killed with a firearm, that they don't lose a family member to firearm violence. So we are thinking about, when we think about gun violence prevention, we actually, I think it's so imperative in the context of children to think about the wide range of experiences and all we are doing to actually prevent all of these types of experiences from happening. So one of the things that actually came up in anticipation of us working on designing this particular study was, we're interested in the implementation of all these different school safety tactics and policies, but also what does that anticipation of gun violence in the school, how might that shape a school's environment, and by extension, the people and individuals who live and who go there to learn and work each day. So I think about prevention of gun violence in a school as both preventing what we would call the direct exposure to gun violence, but also these indirect experiences, which have been shown through the scientific literature to have a very clear impact on children's health and their development and their learning. So,
and beyond just the actual gun violence, a unique aspect of your study here as well is there are no simple solutions in school safety. Every single investment has negatives and positives. You have a limited amount of funding, so anything that's spent in one direction is potentially not being spent in another. And anything that's done on the policy level, specifically with student discipline, can have a profound impact, because from my background in criminology, we know the strongest correlate to being a lifetime habitual criminal offender as an adult is early involvement in the juvenile justice system. So in layman's terms, if you get locked up as a kid, you're probably going to be a lifetime criminal as an adult. And one of the aims of your study here is to understand how these changes in tactics and policies are impacting student discipline. Because if you put something in place that creates suspensions, expulsions, or police referrals, you are turning somebody into a criminal for the rest of their life. So we really need to understand that.
Exactly. I think so we're really interested in this particular study, what we're doing is looking at, and there are about 27 or 28 different these are all at the school level. So school tactics and policies, I'm just going to give some examples here, but we'll say metal detectors or teach policies that allow teachers to be armed with a firearm, or even emergency preparedness protocols like active shooter drills. Thinking about the wide range of tactics and policies that are implemented in schools across the nation. And some schools implement a few of them. Some schools implement many of these tactics and policies that we're studying. And we're interested essentially in answering the core question, which is, do any of these tactics and policies, whether alone or in combination, do they contribute to reductions in intentional forms of gun violence in K through 12 public schools? And we're looking at a period of about 8 to 9 years, so 2015 until just the end of 2023. So we have again, thanks to your data, David, we're able to really identify a full gamut of what we're calling our case schools. So in our sample, we have about 320 plus. We're still in the middle of data collection right now, but let's say 325 or so what we call case schools that meet our criteria for intentional school shootings. Not to say that other types of gun violence in schools are not important. They absolutely are. But as we do with many research studies, we want to give our study some parameters, and we decided to focus in on intentional gunfire. And we have matched those case schools to 325 control schools, so schools that have not experienced that kind of gun violence on their property, but could have, right, during that same period. And that's having that comparator group where we're actually looking at both case and control schools is allowing us, from a scientific standpoint, to rigorously ask and answer some very key questions. And we're going into this with a very clear understanding that there is a very limited evidence base on any of these tactics and policies. We really don't know whether these work or maybe do work. And this is what we're trying to figure out. If there are tactics and policies that are very effective and helpful, then we should know that, and schools should know that. If they're not helpful, then schools should also know that as well, because as you so thoughtfully pointed out just a few minutes ago, schools, public schools in particular, are very limited in terms of their resources. I mentioned earlier, public schools have historically been under-resourced. So if we're investing all our funding into a handful of policies or strategies that don't have any effectiveness, then that seems like a poor use of funds. It feels like a poor use of time. We want schools to have the best information possible. And that, being able to really objectively, in an unbiased way, ask and answer a set of core questions is what we're hoping to do in this work. So we're right now in the middle of that data collection process, but we'll hopefully have some findings emerging in the coming year, which is pretty exciting.
So building on evidence-based injury prevention,
mm-hmm.
and you mentioned, that gun violence overtook automobile deaths for children.
Mm-hmm.
And that's something where in this country, we have very, very good data on motor vehicles. We know how many there are. They're all registered through insurance, how much they're driven, how they're driven, how often people have accidents, the characteristics of roadways, that these are the times, the places, the types of intersections, the types of curves, the bank of the road. All of these things go into the safety of that road. And then at the same time, the automobile industry, especially in the last 20 years, has significantly changed the way that there's driver assist technology and smart airbags and better cars, and all of those technological pieces, both within the physical infrastructure and within vehicles, taking this is the evidence of what happens, and these are the things that we can do about it, have also been combined at the public policy level with things like changes in speed limits, requirements for all people to wear seatbelts, requirements for kids of a certain age to be in a car seat, free resources like giving car seats away for free. You can go to the fire station in a lot of jurisdictions and either get a free car seat or have it installed by somebody that knows how to do that properly. You add up all of these things where you have evidence and data, technological innovation, and sound public policy that's based on it. And now it is significantly safer for a kid to ride in a car than it was 40 years ago. We haven't done any of that in gun violence prevention. And I'd like you to talk as somebody that's been in this space for about a decade longer than I have. Why don't we have this data on gun violence?
You know, the analogy to motor vehicles is a very apt one. And I have many colleagues who have spoken very eloquently and specifically about this because, 30, 40 years ago, this idea of car seats and seat belts and thinking about the prevention of injury and death via motor vehicles as a public health issue was very jarring and not welcome and not something that was initially embraced. But exactly as you've just detailed, we have implemented very successfully essentially what is a public health framework to the reduction of motor vehicle death and injury in such a substantive way. And not only that, but our social norms have changed. So this idea that, drinking and driving is something that we designate drivers. We talk to college students and teens about this. We have normalized that the safety and well-being of each other is important. And if you'll notice, we have not taken cars off the road. We have not said, in fact, car ownership has increased during this time.
Well, in fact, I don't think anybody could deny that on average, the cars that you ride in today are the nicest cars that anybody has been in the history of mankind.
Right.
Cars have amenities. They're comfortable. The seats are better. The drive is better. The fuel efficiency is better. Well, regulation and safety have not stifled the experience of the consumer.
Exactly. In fact, they sell themselves. One of the pros of making a car purchase is based on their safety features. Our automobile companies pride themselves on the safety and efficacy, the safety of their vehicles, as they should. And so it's really remarkable to see how that whole industry, and by extension, this whole area of injury prevention has shifted in the last decades. We have enormous potential to do the same thing for gun violence. And I have said this in many other spaces, but the idea is we here in the United States need to figure out how do we coexist safely with the 400 plus million firearms that are currently in circulation in the United States. We need to figure that out. And there are ways to do it. And this is where we are so grateful for research in this space, the science in this space, because that science is contributing to our understanding of safe storage practices and what policies actually do work, at a federal and state level, and what practices in a school are effective, right? If we actually look at the gamut of science in the gun violence prevention space, it is extraordinary, and it has lent us many solutions. The challenge is we need to implement multiple solutions, right? We can't just rely on one single policy or one single practice to fix what is a very complicated public health issue. Just like with motor vehicle safety, we don't rely just on seatbelts. It's the combination of strategies you just described that allow us to drive safely to and from each day. Now, the data question, I think, is a really, really interesting one and a challenging one. I think there's two things at play. One is first and foremost, the data that have been available, or the data that do get collected often are focused on injury and death from a firearm. And that makes sense because that's also typically like something very concrete you can measure, right? It's something you can look at a hospital record or you can look at a police record and there's something very clear you can document there. The challenge is these other types of gun violence experiences that are harder to document because they have reverberating effects on children and on communities. It's hard to really capture, for example, when there is a school shooting, how many people really are impacted, what happens to that sibling, the sibling of someone who lost their life down the line. Like there's so many, gun violence is not, the impact of gun violence isn't a short-term impact, as we know, right? It changes forever, for lifetimes, for generations, an entire community. So one thing that I think is very challenging is we don't, I think, fully understand as a society what should we be collecting data on. I think that is really challenging. But as you know better than anyone, the data collection of actual shootings has been so limited. And many of us, my team included, are so grateful to researchers like you and others who are devoting time to really thoughtfully, comprehensively collecting the data that are not being collected at a systematic way by other, like by large federal agencies, for example, right? Or like by the federal government.
And that's what's strange here in gun violence. It's a very odd space that it's grassroots, either funded by philanthropic groups or self-funded, in my case, to collect information on the number one cause of death for children and teens. Because we collect incredible amounts of data on the most mundane aspects of our society. We fund efforts for public health surveillance, for disease surveillance, for injury prevention, for poison control, for all types of product-caused accidents. You can definitively say that, the reason that this toy is getting recalled is because 31 kids were injured based on this type of accident across these states in this time frame. We don't do that on a national level for gun violence. And I think that is really a reason that we haven't based school safety or a lot of injury prevention efforts on empirical evidence, because that data just isn't there from an official source.
Yeah. So right. So, and I should double check this, but we can get firearm related injury and death data through like the CDC's Wonder database. You can get we can get those data, but and correct me if I'm wrong, what I think you're describing is the more granular pieces of information that are specific to different kinds of shootings. Like, for example, I mean, your database is a really terrific example of this. Like, who is systematically collecting that level of...
Yeah, you need to know the who, what, where, when, and why of a shooting happened to understand. Yes. And one of my favorite examples of a system that for $20 million has saved countless numbers of lives is the Poison Control Center. And the Poison Control Center has one number you can call for free from anywhere in the country. And when you call that number, an expert will tell you what you took. Is it dangerous? These are the actions you need to take. But on the back end, every one of those calls to the Poison Control Center, whether it's from a citizen or from an ER, from a physician, is all being logged. And they're collecting information about who took this, when, why, how much. Was it accidental? Was it intentional? Was it mixed with other things? And the reason that you would have a safety cap on some product and maybe not another is because when you have information and you say that X number of kids overdosed by accident on this product because they were able to open it, then all of a sudden you add a safety cap that costs 1 penny more and you save thousands of lives. Like, that's the power of data collection. It's not to advocate for a specific policy. It's not to overturn an amendment.
Exactly.
It's because when you understand this entire system of interactions, there can be little steps that are taken that have a downstream effect of saving or preventing injury for thousands of people.
And that, you just used the word system, and I think that's it. That's a big part of it, right? So we have, like, we started out the conversation asking about how I arrived at this space, and I mentioned the field that I'm in, which is school health, which is essentially the connections between public education and public health. But if you think about it in practice, we have our Department of Education completely separate from our departments of health, and it takes a lot of real hard work to connect these different resources and to have these data systems talking to one another. And it's very complicated. We have, in some ways, by siloing off, it's very siloed, right? The way we've structured our, we keep criminal justice separate from education, separate from public health, but they're all intertwined.
And that's failed us in the past.
Exactly.
Like, we know that the 9/11 attack, which by lots of evidence was completely predictable and avoidable. When you had the critical data coming from 30 different agencies, it doesn't get put together. And that's where we sit in this gun violence space, that there may be some state data, there may be some local data. Things may sit within the CDC, but they're 18 months behind. Things may come out in the FBI's Uniform Crime Report, but that's 2.5 years behind. And when this is an issue that I think a lot of progressive thinkers see as a public health issue above all else, public health is based on real-time surveillance. You need to know the trends as they're happening. Because if you're in an epidemic, if you're in something where the pattern has changed dramatically, if you're waiting 2.5 years to find that out, it's already too late. The number of shootings at schools have increased tenfold, mostly because there are more teenagers carrying guns and shooting people during fights. That's something we need to know and understand and address in real time.
I think the real time component here is so key. There's sort of three things. One is, what is the issue we're collecting data on? Like, what's the scope of gun violence? What are the systems and pieces that need to be talking to one another, which historically have not, and certainly not within the context of our K through 12 public school system. That has just never been, it's just very, very challenging in that way. And then exactly as you're describing here, I mean, we need to know now gun violence is so prevalent. There are an estimated 300 individuals shot every single day in the United States. So we need to understand what is happening, exactly as you said earlier, the who, what, when, where, why. What are the parameters around that so that we can use not just one incident, but the pattern of data, the geography, the location, our understanding of the risk factors in all ways, right? There's, without placing blame on a child per se, but really trying to understand what are the systems that failed an individual who then was able to get access to a firearm and use it to perpetrate harm against themselves or someone else. What are we doing to really invest in prevention at all levels to make it so that the likelihood of a shooting is very, very low? Something that I think is so critically important is also expanding the scope of what gun violence prevention can and should look like. And I feel like, David, you and I have talked about this a little bit before, and it's reflected in a lot of the work you do as well. But, certainly school safety, when we think about metal detectors and stop the bleed programs and emergency preparedness response, all of that is important for the purposes of potentially responding to a shooting in the moment of. But really, public health, and where my work mostly sits, is saying, what are we doing months and years before that to actually disrupt the upstream causes of gun violence well before an individual is a threat to a school or to anyone in that community? So when we start thinking about gun violence prevention as disrupting cycles of disenfranchisement and investing in public libraries and in green space and being far more creative and actually looking at what the science tells us, we can actually do much more to prevent gun violence in school or elsewhere. But we have to reframe that conversation. And this is where the data piece is so critical, because if we're actually tracking that data and making sense of getting a sense of the whole picture, it allows us to inform some really thoughtful strategies that have nothing to do with taking firearms away or restricting, civil rights, but really thinking about how do we ensure that all of our kids are safe. And there's not a single person or parent who would disagree with that. I think this is where we have to also figure out our common ground. And there's much more common ground and overlap, I think, on this issue than some might have us believe. And I do think that's where we can, right? I do think that's where we can figure out, okay, what are the commonalities here? So I think a lot about how are we investing, how do we reframe the conversation to be more about prevention and less about reaction. I think that's also where the motor vehicle industry has had enormous success, because they're saying, okay, before a designated driver gets into a car, what are we doing to, not before a designated driver, before someone who has, so before someone chooses to drink and drive, what are we doing to reduce that risk in lots of ways? And there are a lot of parallels here. And I think with better quality data, a real data infrastructure that thinks about the scope of gun violence in all its forms, again, tracking the geography of it alone is just for us to understand, trends and where we see not just where gun violence is happening, but the kind of gun violence that's happening.
And how. I mean,
and how.
I was shocked in a study that I did last summer,
Mm-hmm.
looking at shootings, 1,000 shootings in public spaces,
Mm-hmm.
that the most common location for a shooting out of this kind of random Google Alert sample last summer was a grocery store. And it was almost always customers of the grocery store getting into a dispute, and then somebody's armed, so that dispute turns into a shooting. That's the same characteristic of the pattern of increased gun violence that I've seen on campus. And that's something that has very important public policy implications. Because if you're a state where you're considering loosening regulation and encouraging more people to have firearms with them in public, you need to understand that the data shows that the byproduct may be that a lot of people get into disputes that turn into shootings at the supermarket. I don't think that's what anybody wants. I don't think anybody wants to be, and most of these, interestingly, were in the afternoon, because I not only, code things by the clock time, I want to code things by a time period that gives it context, it's aggregatable. But that's just when we don't have that real-time data, we're not seeing these patterns happen in real time. So my last question, because I know we're running out of time, but the next presidential administration, it doesn't matter who it is, they've decided to combine Department of Education, CDC, Department of Health, Department of Justice. They're all going to be one agency. It is an agency that has purview over every state and local government. We now have all of the pieces are together, and you've been appointed to head that agency. What would you change tomorrow to make an impact on gun violence over the next decade?
I would take a nap first, and then so here's what I would say is, while there is so much research, there's so much we still need to know. Gun violence is incredibly nuanced. It is, as we were saying earlier, there's different types of gun violence. We don't just lump all types of cancer right together. We think about it's nuanced. Who's at particular risk for a certain type of gun violence? What are the risk factors? Not just for a person, but for a place, for a location. How are we changing and reshaping the environments, right, in which we live and learn and our children play? So we want to think about the prevention of all different kinds of gun violence. In the context of schools, since that's sort of been the focus of our conversation today, and I know, of course, of your work as well, I would say, listen, there's so much we need to know, but there's a lot we already do know. And we know that fundamental investments in communities to make communities safer, right? I mentioned this earlier, but green space and affordable housing and street lighting and public libraries and access to jobs programs, and really, again, breaking those cycles of disenfranchisement. And by the way, also states with more restrictive gun laws, okay? So taking together all of these kinds of investments, all of these kinds of policies that we do know work, that combination, coupling them with shifts in our actual public school settings. So doing away with really punitive disciplinary policies that are very exclusionary, that often take a student who might be at particular risk and removing them from access to mental health services or healthcare services, or even just other trusted adults, and replacing that with bystander intervention, with restorative justice policies, with peer-to-peer interventions that we know work, universal school-based violence prevention programming, thinking about the school as an ecosystem, engaging with school nurses, helping families with safe storage, really thinking about a child and a school not as its own kind of isolated building or experience, but as part of a broader community. When we do that and we pull all those levers, we could see changes and reductions in gun violence. We would see those changes happening. And this is not opinion. This is based on a wealth of research that has been conducted by extraordinary researchers across many disciplines who have all thought about this issue in very thoughtful ways. And there is a role for emergency preparedness. There is a role for engaging with law enforcement. There is a role for working closely with gun owners, because we want an all hands on deck approach to thinking about what those solutions look like. It is not either or, it is all of us together figuring this out. And so what I would do is really take and pull on those levers that we know work while saying we still got to invest in that good quality research so we can continue to understand that nuance. And importantly, also to recognize that there are 45,000 people who are getting shot and killed from gun violence every year. And those communities are grieving and will continue to grieve. And so we also need to think about, that aspect of this issue, which is so important and I think doesn't always get talked about enough when we think about the impacts of gun violence, like in the long term. So those are sort of in a very short, my kind of 1 minute summary there. Those are the different facets that I would pull to say, here's a workable solution that, by the way, would also result in lots of benefits in other ways, right? When you invest in green space, it's not just about reduction in gun violence. It improves mental well-being and improves social cohesion, and nothing about a park would ever make anyone feel anything other than just better. I mean, there are so many benefits that would come from thinking about gun violence in this more expansive way. So I think this is what gives me a lot of, I'm not going to use the word optimism, but I would say hope in the context of this issue, to say this is a fixable, solvable issue. We really just need to be pulling on those. I've said lever now about 1,000 times in this episode, but we really got to figure out what are the right ones there to pull. But I think we can get there.
I completely agree with you. I do this work because I remain hopeful too, that better data, better evidence can lead to policies that we're constantly evaluating and constantly refining until we get to finding better solutions. So thank you so much for joining the show today. This is Dr. Sonali Rajan, from professor in the Department of Health Studies and Applied Educational Psychology at Columbia University. Down in the show notes, there's a link to the new paper. It's Protocol for a Nationwide Case Control Study of Firearm Violence Prevention Tactics and Policies in K-12 Schools. Sonali, thank you so much. We'll talk again soon.
Thanks, David. Great to be here.